this girl really just go already.
There's a lot of dirt.
Welcome back everybody to another episode of the Crackdown. I'm your host today, Kay, lead chiropractor from Relief Chiropractic. Today we're going to discuss something really interesting and something we've never spoken about on the podcast before. I have a very special guest with me today, Dr. Sonia Lee.
Hi! Hello everyone!
Any guesses? I'm sure it's on the title already, but any guesses what doctor she is by how she looks?
What do you
Aesthetic
think?
doctor?
Girl,
So pretty
you're too
must
nice.
be, something to do with aesthetic. Well, in some way it is, because we're talking about, today we'll be talking about how to make people smile better.
That's right.
Yes. Welcome.
Thank you for inviting me, Peachy.
We've already spoken so much before this, so it's like we've already properly warmed up. So it might sound like we have nothing much to talk about. We've been talking for like almost half an hour already before we started shooting.
We have plenty.
But I'm so excited to talk to you all about teeth, lifestyle, and everything else that will be popping up today. Before we start, for those of you who don't know who Dr. Sonia Lee is, let me give you a brief introduction. Brief, actually not so brief. Dr. Sonia Lee,
Yes, girl.
ready? An accredited prosthodontist.
Yes,
Did I say
that's
it right? Prosthodontist?
Yeah, maybe a little accentuated prosthodontist.
Prosthodontist, recognized by the Malaysian Dental Council. Dr. Lee graduated with first class honours in her Bachelor of Dental Surgery, a member of Royal College of Surgeons of Edinburgh, and completed her specialist training in prosthodontics at the NUS, National University of Singapore.
That's right.
Round of applause.
Arigatou gozaimasu. Thank you guys.
Oh my goodness. So how impressive. She's also a lecturer, a clinical supervisor, a business owner, and an international speaker.
That's right.
What do I owe the honor, the pleasure of having you here?
Thank you so
Apart from
much.
personal connection.
It's true. Well, if you guys would like to know more about Peachy, we go way, way, way back. So we'll
They'll be
save
like,
it
who
to
is
later.
Peachy?
Oh, that's how we call her in school. Peachy.
That's me, by the
But
way.
anyways-
That's my Chinese name.
Anyways, thank you so much for having me here and
Of
your team, your wonderful
course.
team. It was a nice introduction. It was actually quite
It's the
brief.
truth. It's
It
the
is
truth.
quite brief.
Oh shit, it's
You
brief.
You've got
There's
one
more?
more, but I don't think it's necessary
No,
now.
please
Time-
tell us more. What did I miss?
No, time is precious. We should keep it. We should get down to business. We need to know what's
Okay,
going on.
okay. Dr. Lee is very busy, so let's not hold up too much of her time. Okay, let's go. First question, which I'm sure a lot of you are asking, what is prosthodontics and how does it differ to my regular dentist from next door, an orthodontist? What do you normally tell people that when they ask you that?
So, prosthodontist is the person. So basically, I'm a dental specialist, whereby it's similar to medical, where you do your initial doctor BDS. I mean your initial MBBS, which is your regular doc GP. Then you further study to become a specialist. So you become a prosthodontist. Prosthodontics is basically dealing with the prosthetic parts in dentistry. Into simple terms, I'm basically the architect of the mouth, right? I restore form, function, and aesthetics. Basically, that's it. With what? With crown, bridges, and anything that's fake. But I'm not fake, I'm real, by the way.
That is such a great way to get people to understand what you do. An architect of the mouth.
Yes.
So not just teeth.
Not just teeth, because teeth is just what you see here. But in the mouth, there is muscles, there's joints, and it goes deeper up into the mind, into the brain, right? Very much into like how people perceive. So it's a lot of psychological component to it.
Yes.
And the mouth, as Chinese, we love to eat, right?
Yes.
So we live to eat. We don't eat to live. So if you have nothing here, we will be very unhappy. So that's what we do, restore everything and to make you happy again.
Yes.
Not just by looking good.
That's
feeling
such
good.
a big psychological
I know.
impact for people who is either not happy with how their mouth look or it's not actually functioning the way that it should.
Yeah, that's right.
Speaking,
Yeah.
eating, all those
Correct. I
things.
mean, imagine if you can't eat KFC all of a sudden, you know, and then you just pass by and then it smells so good and you just want to eat, but I can't chew. And then you start blending your food out. It becomes really sad not just for your tummy, but psychologically. I think also for the people around you, because they will feel that impact and how it changes it. So to me, the mouth is very important, because what goes in shows. It shows in your skin, it shows in your health, it shows in your mind, everything.
Very true.
And you become very
And
nutritious.
how much you eat.
Well, then you become nutritious. Cute.
So, to put it very simply, I would, layman, like a third person, if I don't know anything about this, when I think about dentist, orthodontist, and what you do, prosthodontist, as a prosthodontist, this is going to be difficult, this episode. I would think that, like, if I have a chipped tooth, one chipped tooth, nothing else happening, I might just go to a dentist.
Right?
If I have problems that maybe extend further, like I don't really like how it looks, it's affecting bigger parts of my life, or I actually have pain, even though when I look at my teeth there's nothing wrong, then I might go for someone like yourself to help me figure out
Right. So
how I can improve the function.
correct. I mean, when someone chips their front tooth, it becomes quite socially awkward, because you become very shy, very, very aware of what it is. But when somebody comes to me, and how I manage it is, first of all, why did the chip happen? If I'm unable to find out the cause of the chip, I may not be able to solve it in the long run. For instance, let me give an example. Like when we eat, we will have a habit of maybe biting on our chopsticks before we start our meal, right? Or maybe in between meals, we will put the chopstick and we start clink clunk, and then it chips one day, for instance, and then I fix it for you, and then it chips again. But I did not find out the cause of the chip, and therefore it may end up causing you more than anything else. So for me, and I think a lot of my fellow dental colleagues will have do the same as well. So you don't necessarily have to come to me for a chip of your tooth. You can go to any trusted dentist that you have, that you're comfortable with in your neighborhood, which is fine, right? But at the end of the day, any problem that you want to solve, you have to find out the cause first.
Yes.
So adding on to that, very similar, where I have patients. Okay, let's not talk about patients. Let's not go too far. Let's take me as a subject. I have a fractured tooth in the front, you can see here, right? Back then, I was in NUS. I was doing my master's, my specialization. It is very stressful, trust me. I've been challenged, like, mentally, it was really very stressful. So I was just doing my work one day, and then my friend told me, you are just doing this, like edge to edge clenching. I said, no, I can't be. It looks horrible. I don't think I'm in that position. It's just too awkward.
Yep.
So I didn't believe her, by the way. And then one day I was just studying for exams. And then I was like, why is there a piece of stone in my mouth? And I'm not even eating. I'm not even snacking. I actually love to snack, by the way. So, and then I just spit out, and then I was like, hey, what is this?
Oh my goodness.
I just ran to the mirror, and I was like, oh, and that was a chip. And then I rang up my friend, who is a dentist, a very well-known Dr. Jerry in Singapore, in Orchard. I was like, you need to fix my tooth. This is a social nightmare. It's psychologically impacting me quite a fair bit as well.
Yes.
So I went and get it fixed. Guess what?
What?
After 6 months, it chipped off again. Because I was in a constant stress, and I'm constantly doing this, not being aware, right? So I'm not mindful about my actions when I'm stressed. So now as I graduate, as a patient myself, I start to understand things a little bit better. So when patients come to me with all of this, then I could actually tell them how it is and why things work or don't work. So I put myself as a patient first, then I try to relate that to the patient.
Yes, and not just that quick fix, instant solution, but like how to prevent it from happening again. If
correct.
Stress is a common cause,
Yep.
it's just gonna happen over and over again.
I'm so sorry, I'm just a dentist, but you also have a chip on your front tooth.
I was gonna say! Mine is on the right.
Yes, that's right.
And this is from when I was swimming when I was young.
Right.
And I didn't realize I was already at the end.
Right.
I got up and I slammed my tooth on the
Right.
thing.
And that is a lot of things. Actually, it's more than that. Sometimes it's a lot of habit. So when we speak, some, like for yourself, you tend to posture your jaw forward to come into a forward position. and that's quite a natural thing to do.
When I realize when I'm listening, because we've been filming this podcast for a few episodes, right? Every time when I get it, I'm like, so you feel like my bottom is more forward. That's a word.
I wish I could just a mirror up and then show you nah. But yes, I mean it's a habitual thing. It's how we speak, because all these are controlled by muscles, right? So through things of observation, we are able to find out why things break, and then from there, then we are able to mitigate the issue, and then give you a solution at least. But say, even though it's just fixing it with just a filling, but at least now you're aware why it's chipped. You are more aware of the situation.
So are you saying that the position of your jaw or teeth, let's just say for me, for example, that would make me more prone to have a chipped tooth?
It depends on your alignment and everything. So for instance, if you're always doing this when you talk, right? There's always king kang, ting kang.
Yes.
There's a tendency it will chip,
of course.
Right?
Yes,
but if you're speaking but you don't come forward, then there's no constant trauma. Does that make sense?
Right. So would a person that is very, very sociable and like talk non-stop or talk for a living have a higher chance of all these issues compared to somebody who is like a loner and quiet and don't speak?
No, not at all. It really depends on, like I said, your habit and everything. I mean, you can be speaking, but if you don't come forward, your jaw like this, or you don't have a specific place where you clench or bite, there's no constant trauma, there would be no issues actually.
Got it.
Right.
So how did you manage to stop yourself from doing that? Or is it still ongoing?
Fortunately, life is more stress.
I was going to say, life is so stressful,
Yeah,
which we will talk a lot about later.
Right.
A day in Dr. Sonia's life, it's hectic.
Yeah, so it's stress you can't avoid, right? It's always there. It has to be there, because then it pushes you to go further. But it's just how you manage stress. That's another thing again. So for instance, knowing that I clench and I posture forward when I'm stressed, it's just like fight and flight. When you're in a boxing match, you see people doing this, clenching, right? It's similar. It's just a way of how we are coping. So whenever I do that, I would just tap myself out of it, like, hey, stop doing it. It's just being mindful. So that's why I said before that I was not very mindful about what I was doing. Then after that, when I realized what I was doing, then I just remind myself, hey, stop. You don't want to have another fractured tooth.
Got it. Would you say a clenched jaw or like teeth positioning, just this scenario that we're talking about, is something very common that you see in practice?
It's very common. Like I said, we are all living in a world with all kinds of stress. Everyone's stress coping mechanism is very subjective. How you cope and how I cope in that same situation may be very different. So everyone's way of coping is so different. So for example, I clench. I used to have a habit of nail biting. It's also a way of stress, right? On peeling or whatever. I stopped. So then something else to go. So clenching was another one that I picked up as another habit of coping stress. So at the end of the day, clenching or grinding, I mean, they're both two different things. Some people grind when they're stressed, and some people grind when they sleep. So that's another whole different ball game or topic again altogether.
Got it.
So at the end, they're just knowing lah.
Yes, it really sounds like I would imagine if I'm a client and I'm seeing Dr. Sonia for the first time, the conversations that we'll be having is so different from the conversations I had with my dentist before.
Right. I would say it's dependent on your treatment philosophy, right? Or your approach.
Exactly.
So my clinic name is Clarity Dental. It's situated at Jaya 1, and there's a reason why we named it Clarity. So my husband and I, we set up the clinic. Clarity in the sense that we want to give you clarity in the things that we say. Like, it's not just come in, open your mouth, and then we drill.
That's what everybody does. I mean, every dentist.
No lah, it's not true. But again, it depends on how the way we practice, right? There are a lot of colleagues of mine who practice amazing dentistry, whereby they do all this, they talk to you, they get to know you as a person. For us, that's what we want to do. We want to give clarity to the issues, right? As much as we can based on our knowledge and our expertise. So yeah, that's how it is.
That's very appropriately named.
Yes.
So in your center, because you are also a business owner
at
the moment, you and your husband, and there's a couple of other associates
yes,
as well. Do everyone do the same thing as you do?
Right.
Or you are the only one who does prosthodontics.
That's right. So in our clinic, we have quite a number of us. Actually, most of us are specialists, and we have colleagues who do general dentistry as well. So we do what we do best. So I'm the prosthodontist, so I deal nothing but the crown, bridges, full mouth rehab, implants, crowns, dentures, whatever. Then I have a periodontist, Dr. Tan, who does nothing but the gums. I have Dr. Benji, who is doing nothing but oral surgery. I have also my another colleague, Dr. So, who does with oral cancer, which is very rare, cancer rehab. In she's very, she's an amazing lady as well. Another lady, which is very nice because the clinic is full with men. So we have also Dr. Go, who's my orthodontist, who does aligning of the teeth. And we have Pete's dentist as well, pediatric Dr. Gun.
I see.
Yeah, and my husband, Dr. Eddie, and Dr. Ryan, who does basically most of the general work, does the fillings, does amazing examination and diagnosis. So we work together as a team.
Okay.
Yeah.
So when someone calls in to make an appointment, let's just say they didn't specify who to see.
Right.
They would probably tell you, I'm having this issue.
Right.
And your front desk would allocate who to see first, or they will assess first and then
So
refer out.
usually if it's very specific, for example, my patient comes in and say, I have jaw issues, I have jaw pain. And then my front desk would know to refer it to me, right? Or instance, my patient comes in and say, I would like a consult, for just whatever. Then my husband, Dr. Eddie, and my other colleague, Dr. Ryan, will do the assessment first, which is a general assessment. And then they will call us in between to do the necessary consults. What is necessary for them.
Yep.
Yeah, so
What
that's
is
how
the
it
recommended treatment.
Correct.
Based on what
Yep.
the first, it's almost like a GP.
Treatment plan, we
Yeah.
do a treatment planning. We let you know everything. Of course, at the end of the day, it's the patient's own authority to decide what they want to do.
Yes.
But it's our responsibility to explain what we see, what we would advise you to do.
Yes.
And then that's how then things gets rolling.
Understand. So before you actually came earlier, we were talking about veneers.
Right.
Because it's everywhere now, and it's
It
kind of
is.
like, whoa, sometimes it's the first thing you see when somebody opens their mouth.
It is.
Sometimes it's in a good way, sometimes it's not in a good way. What are your take on veneers?
This is a very tricky topic. No, I'm just kidding.
No, I really think it is. We need your opinion.
Yeah, for me, when it comes to treatment, necessity of treatment, it really depends on the need, right? The indication. For instance, if a person comes in with, teeth that are just discolored, and this person is a social media influencer or a superstar, and they really need to have that appearance, right? And because the teeth are so discolored or not so great, veneers may be indicated. It really depends. Not everybody is suitable for veneers. Let's just put it this way. To me, God-given tooth is precious. I do not want to take it away from him, right? I do not want to cut it and to replace with something that is fake. Because, put it this way, anything that we do all can break. So if a young person comes in and says, I want veneers, I'll be very apprehended to say, yes, you need veneers. I will ask, why do you want veneers?
Because it's cool. My friend got it and she looks good. My dad friend got it and looks
So then
good.
we have to tackle maybe something deeper. Is there something that is making her feel that way? Because if you're constantly chasing for inadequacy, to be perfect, it will never be an end goal. And then, after doing that, there may be something that you are now very engrossed into, and then it might affect you socially, psychologically, mental health, right? And it's not fun. So with social media, there is the good side and the bad side, right? The good side is education, something like this, where we put out education, we inform. Then there's also the bad side where people feel pressured, peer pressured.
Yeah.
I want to look a certain way. Then I try to apply on myself, but you cannot apply what you see on others to yourself. It may not be necessarily be very needed, right? And then at the end of the day, example, you do the veneers. It costs you a lot of money. And then say, example, you're a young person and then you just started work. how much of financing is going to throw into it?
Exactly, and they're not cheap.
They're not cheap either. So I think there's a lot to consider when it comes to veneers. Do I do a lot? No, I don't. I don't, because I will try to tackle why do you need it first, unless it's really, really necessary. And yes, there's a very strong indication to it to do so, I will do it. But if it's just for, then I will opt for something more conservative. For instance, if your tooth is crooked, just go for simple braces, right? To align your tooth. I don't cut anything. I straighten your teeth. You look great after that. You look natural.
Yes. What an ethical doctor.
That's why I'm not a very good businesswoman.
No.
I'm very real, by the way. I'm
No
serious.
way.
You know, a patient comes in to me and says, hey, doctor, I want to do. I was like, oh no, I think you better not do.
You're like the mom that like, tell me why you need this. I need a reason.
And
I'm
then
just
we
gonna
like,
buy everything for
okay,
you.
you know, there goes my income. No, but it is what it is, you know. It's not
It
worth
is.
the money earned. I feel, to me, that's me.
The leong sam cannot, right? If you feel like this person is just wanting it for the wrong reasons.
Yeah, and so that's how I judge. But per se, let's say example, someone diagnose and say, yeah, it's indicated, and then I'm sure the person, whoever is indicating it has also good intentions. I'm very
Yes.
sure to make you feel better. So I don't think there's really wrong and right. At the end of the day, it is a relationship between the patient and the doctor, and then to come into terms whether this is what it is. Because before even the patient has to do the veneers, the person has to consent, right?
Yes.
So it's a two-way thing.
Of course,
Right.
of course. So I'm sure it's common because even people like us not in the dental field already come across with people who once veneers or had good results with veneers, had bad results with veneers and regret it. And also you have another group of people who do it veneers with people who are not qualified to deliver this sort of thing. Do you need special qualification?
Right. Okay, so that's where the line is drawn between being a qualified dentist to do it versus somebody does it in a hotel room who is not even qualified to do, which is very common. Because a lot of times people go to this kind of back room, I would say back door treatments. It's either the cost is very cheap, right? That's why they end up doing it.
Yes.
Then there's a biological cost to your tooth, right? Because once you do it, you look great for a couple of months. Then the effect is just irreversible. You may end up paying more just to salvage what you have. Or I've seen some instances whereby the case is not salvageable anymore, which is quite scary. So I always tell patients, you know, if you're going to do something that's related to your body, to your health, try not to gamble with it.
With something that is irreversible.
Irreversible, and somebody who is not very well versed with it, right?
When you say irreversible, because from my understanding with veneers, how they install is they shave the top part of it
Yeah.
and they put something on top of it.
Right. So basically, shaving is taking away.
Yes, and that
It
cannot
never
be...
grow back. It will never grow back. It's not like plants, you know, you chop out the top, it will grow again.
It's not like nails where you did it and then it grows back.
Correct.
Oh my gosh, okay. So for people who are already, even if they do it with a professional, what happens when they remove the veneers? What happens underneath their teeth?
It's just like you're wearing clothes and you take off clothes.
So you forever need to have clothes on top of your
you whoever need clothes or not, now you'll be exposed bare.
Oh my
Sorry,
god. 18. So it's for life, the minute you install it.
Yeah. And you need maintenance, right? Because
Yes.
anything on top, you need to maintain. Because if you don't maintain, you're going to get decay, you're going to get gum issues, blah, blah, blah. And then you're going to end up spending more money trying to fix it.
It's going to be compulsory to have the veneer on rather than optional the minute you start.
Yeah, you have to, because it's like wearing clothes on. You need to have clothes on.
It's already so much thinner.
Yeah. And you get sensitivity because now that you remove that layer of clothes, right? So imagine a wind blows, you get sensitive.
Goosebumps.
I think that's a very easy way to understand things.
Such a great way of explaining it. I feel cold
You go
suddenly.
getting highlight, wow,
You need a jacket all the time. Oh my gosh. Okay, so for any one of you who are considering veneers, I think that is something that would actually really make me think twice, if not thrice, about it, because it's really not like nails where I don't like it, I remove it, and with time it just comes back out.
Yeah. So I think a lot of people think it's like that.
Yeah.
You know, but I would tell you it's not. When someone tells you, oh, we trim less, the minute you trim, you take out that handpiece and burr, it's already cutting away God-given, beauty. So don't think twice, thrice.
I'm sure unless there are extreme situations where you absolutely need to, that's why this technology came about. But it's really something that we really have to consider.
I mean, this design they came out is in the sake of being conservative as well. It's rather, veneers are one-faced, crowns are all around, right? So they came out with this because they didn't want to cut teeth 360. So they thought that, in order to beautify, you're able to add some, like a laminate, right? Laminate floor like that. So there's good, there's bad. It's really based on the indications, I would say, at the end of the day. Right? And informed consent.
And it all starts from seeing the right person, honestly. Because none of us are expert in this, and based on the amount of studies that you did all these years, how many years in total did you get to where you are now, by the way?
That's a long time. So degree alone takes 5. And then I did government service for about a year. I came out to practice in private 1.5, and then another 3 years of subspecialization or specialization in Singapore. So that's about 10? Yeah, that's a long time. That's a long time, really long time. ROI not good one. So for those who are thinking to be a dentist, to be very not worth it.
No, you have to genuinely be passionate about your job, honestly.
It is, okay.
Which is what Dr. Sonia is, honestly.
So when I tell people to count your ROI, I tell my dad, sorry.
Your dad's like, just go do veneers for the following.
My dad would
Don't be so ethical, just do it.
My dad's not like that.
I'm kidding.
But at the end of the day, it's just passion, right? It takes too long to. So if you're thinking, okay, there's another sidetrack. For those who are thinking that dentists are very rich, for those who watch Mr. Money TV, don't watch. It's not. We are not that rich. It depends.
Only ENT are rich, right?
Oh yes.
Mr. Money. I saw. That's what I learned. So ENT, throat doctors, they are the one that.
No, actually, they're money a lot more. But for dentists, it's not that lucrative. Especially as specialists, because there's a lot of stress involved. So for those who thinks that dentists can become very rich, I say think twice. The world is changing. It's not unlike those days where dentists is scarce, specialists are scarce. Although my specialization is even also very rare. I'm like the 49th in Malaysia.
Very niche.
Very niche.
Yes.
But still, there are more and more dentists. So it's not like those days where there's only in one area there's only 2 of you. Right? So now it's a little bit different.
Yes, and you can't really get to being a prosthodontist without going through all these things that you have done. You have to do the basic 5 years. You have to do all these things. There's no shortcut.
No, unfortunately, no shortcuts.
So that is the value that you're going to get when you make an appointment to see Dr. Sonia in Clarity Dental. Not only her knowledge, extensive knowledge in everything to do with your mouth, inside and outside, but also an ethical doctor. Where are you going to find someone like that? And of course, pretty and nice to look at, and
wear mask
kind and nurturing. Same. That's why we do podcasts so people can see how we look like. I am kidding. Okay. So I think we covered how your journey into this field, and now that you've worked for so many years, I'm sure there are highs and lows.
Definitely.
What would you say make the job worth it? Is there any real life stories that make you feel like, okay, I can do this for another day?
I mean, there are many stories. Let's say, for instance, I have this patient who was referred to me by another colleague, and then he came with the teeth basically just all we would call it end stage. He had gum disease, he had a lot of decays going on, and then he did put in a lot of effort to kind of salvage his teeth. He was hopping around trying very hard to find a solution, but he couldn't at the end of the day, this my friend who saw him and said, why don't you come and find us, because we are a team of specialists. So he came in, and then we managed to diagnose him. He had some he had gum disease, actually, advanced stage. And then he had a lot of decays, which is, the decays, again, when people talk about decays, is not sometimes due to sweets. Fun fact, it could be due to the bread that you're eating. Because bread, white bread, has a lot of sugar, right? Carbohydrate breaks down into sugar. So because of diet, okay, sometimes because of the lack of saliva, your mouth becomes dry. So there's lack of the saliva properties to kind of prevent the decays or whatever, to wash out. So then all this stuff gets stuck to the tooth, and then decay starts to happen, blah, blah, blah. And then he had a couple of decays. He has aesthetic issues. You know, his one tooth was long, and it was long story short, we managed to rehab him. Now he's back to his self. Not back when he's 20 years old, of course, but at least now he's functioning well. He's confident, right? He's traveling the world, which is nice. So those are one of those cases. Or for instance, another few cases whereby the patient comes in with jaw aches, quite a lot, you know, TMD issues, you know, affecting them psychologically, can't really work. I have one, was referred to me by a psychologist actually. A patient came from Malacca. He then came to see me, and then we talked, and then I diagnosed his issues, and then I gave him some treatment, you know, very simple conservative treatments. And now he's back, his life is back to normal. So those kind of things actually bring joy. Yes. Or for instance, patients with dental phobia, I think that's the worst. This Malay lady, very nice, sweet lady, she is so phobic that she steps in the clinic, she starts trembling. And then she comes in to me, you know, when she first saw Dr. Eddie, when she opened her mouth, you can see her trembling. She was just so scared. Poor thing. And then she needed tooth extraction. That was another challenge. So we managed to treat her, and now she's walking into the dental clinic like it's her home. She's able to open her mouth, you know. But of course, we helped her with some happy gas, you know, to make her feel relaxed. There's a lot of psychological coaching. Yes. So the dentist for us is not just open your mouth, we drill and you give us money. So we are like that tooth fairy that takes money from you. Yes. You know, tooth fairy is known as you put tooth under the pillow, right? Your money come. No, we are the tooth fairy that take your money. No, I'm just kidding.
Very qualified tooth fairy.
But we make you feel. I'm just kidding. But basically, yeah, that's one of those few things that, you know, small changes. Patients feel happy. We feel happy to treat them, and then help change life, make them feel happier. You know, that's great, right? Right?
Exactly. And the amount of time that I feel like if you have an hour of treatment with this patient, more than half of that is education.
Yes, we spend a lot of time,
explaining things to them, and the actual work that you do the treatment will become so much more effective once you have that understanding with each other.
It is. So usually our first consult, when patient comes in, just even for a regular scaling, I assume so, we take about an hour plus.
Wow.
Right? Because we want to, we take pictures. Seeing is believing, isn't it? So I tell my patient, I know Photoshop, I'll take a photo, I'll zoom it in the screen, right in front of you. I say, look here, look here. So I'll let you know all the issues that I can see or I can diagnose clinically. And then after that, we'll start with our scaling. But of course, we have to take x-rays just to check for decays in between, because dentists are not born with x-ray eyes, unfortunately. We can't see what's in between the teeth, right? And rest assured, dental x-rays are very safe, right? They are equivalent to just a few hours out in the sun. So it's because of the radiation, right? People are concerned, but it's not that bad. Not like MRI. MRI is a whole different issue. I mean,
whole year under the sun. Malaysia sun.
Malaysian sun. So then we do our checkup, and then, you know, we spend time to talk to patients. Then of course, subsequently, our patients come back for 6-month checkup. Then the consult doesn't become long because patients already know. So it becomes half an hour. So scaling, because the cleaning is done, patients are taking care of it. Yes. So we don't have to put in too much, like to take time to really clean so much. So sometimes the routine visits becomes shorter and effective as well. Because I don't think anyone wants to sit half an hour in a chair and open your mouth.
Yes, opening the mouth for sure, but I actually have a lot of clients, because we do see TMJ cases a lot of the time. So sometimes when I see something that maybe it's something that I'm not sure, and I'll be like, oh, when's the last time you saw your dentist? have you asked your dentist about this? They'll be like, no, half the time my mouth is open, I'm uncomfortable, and then when I'm done, I'm sent out of the room.
Yeah.
So actually not everybody spends that much time with their client. And it doesn't sound like the session will go on as how it would with you at your dentist. So what we normally do is, when it comes to jaw-related cases, is we will try to correct it. If it's a deviation, if it's a muscle issue, we try to release it. And if things are really out of our hand, we'll be like, just check with your dentist and see. Because maybe you do have grinding, teeth grinding, and not just when you sleep, when you're stressed, like what you were saying before. And in cases like this, let's just make this as an example. How would you approach something like that?
So for instance, if the patient comes in with pain, let's start with simple. I have pain in my jaw. I am not able to open my jaw wide. Actually, there are a lot of symptoms and how the patient presents, right? Pain in the jaw is always the common one. And then sometimes they say, I hear clicks, right? I'm sure as chiro, PG, you see a lot, right?
A lot.
Clicks. And then my jaw, I think I have locked jaw. I suddenly can't open wide. And then, or for instance, I feel very fatigued when I start chewing. Or sometimes I will then prompt even further. I say, do you start to hear like they're ringing in your ears? Tinnitus. Okay? Sometimes some patients have vertigo. Okay, I just had one from Sarawak, flew in all the way to see me for that. And then some patients will tell me that it's just affecting my life. I feel the constant headache running upside to the back of my neck. You know, I'm sure you get that a lot, right? So I will slowly start to ask questions, you know, figure things out again. There is pain. So why is there pain? Back to the question of etiology. If you come in, you say I have pain, if I just give you meds, I'm just giving you things to just manage the pain. But I'm not giving you things to solve the problem. So like for instance, patient come to you. Actually, I'm very curious as a chiro. What do you do for your patients when they come in?
It's really interesting because when you gave me all that example, exactly what we see. And sometimes it's like a package deal. Clicking, pain, vertigo, neck pain. So I feel like, I don't know if you can agree or disagree with me, we look at things from back to front, and you might look at things from front to back, like rule things out.
I will look things here. Here. So but let's boil down the question again. Why are there pain? Why? Why do you have neck pain? Why do you have pain here? Why do you have pain in your wallet? Because you're spending a lot of money searching for answers. So then becomes psychological pain as well, right? Because they say, doctor, I've been searching for answers. I see a lot of people already. And everybody says, I see ENT, my ear is okay. I see neuro, I see psyche, I see this. Then they come to me very chan like that, right? Very poor thing. And then, so the word is etiology, right? Now, TMD, this is our joint, okay? So here is controlled by muscles, which you deal a lot with alignment muscles, right? This muscle is a very strong muscle. Okay, remember earlier the conversation I told you about fight and flight, clenching, grinding. So, okay, let's do a little test. You raise up your right hand forward. Okay. Now, clench. Clench as hard as you can without I can't remove, right? It's strong. It's very strong, by the way. Do this for 1 hour. What do you think will happen? Fatigue.
Yeah.
Right? Muscles will get fatigued. If you're constantly clenching, grinding, you're constantly working your muscles, it's going to be fatigue. Right? When fatigue happens, what happens? Muscle becomes very achy. These aches. Then you can't chew because you're now achy, you're fatigued. Then it affects you. You'll be like, oh, why I cannot chew? And then because everything becomes so tense, everything is tense up because you are not even tense.
It starts to recruit.
It's like a what we call a landslide. Chain reaction, exactly. So tense. Then here there's a very strong muscles. Up here there's a temporalis, the fan muscles here. Everything will pull. And this is very close to your ears. So when we talk about tinnitus, there's something called when you have TMD, sometimes you get somatic tinnitus where you go to ENT, they check everything is okay, your hearing is fine, blah blah blah. So tinnitus is basically sound that you hear, but it's not caused by external one, right? And then somatic is is what? Is basically affected by the musculoskeletal, the muscles around it.
Yeah.
So because the muscles are contracting, it's also correlated to the muscles around, then you get this tinnitus. So the tinnitus may not last the whole day, it comes and go. Exactly. It's called erming, ringing. Like mosquito, then you slap but ain't no mosquito.
It's just you.
It's just you. And then some people thought they're psycho, right? Because they say, I hear things, how come, but no one hears it.
Really gets into your head.
So that's when psychosocial becomes. So the patients, because of this, it affects their life.
Yes.
It constantly affects their mood. Now they cannot chew. So can you see it's a very scary cycle.
Absolutely.
So this is a biopsychosocial kind of thing where we have to treat this with that aspect. So it's by angle 97 and you treat it as a biopsychosocial method.
Yes.
So that's why we go with understanding why it happens. So why these tense happen? A lot of times it's stress, right?
Yes.
It's stress releases a lot of cortisol.
Yes.
Right? Stress hormones. Cortisol is actually a good hormone to regulate our blood pressure, blah, blah, blah. But when everything tips in balance, everything goes haywire. So that's when you have all of these issues. So I'm sure when you hear clicks, when you help patients, I'm sure you help patients to kind of align back, right? They feel instant relief, like very good. Because why? When it's tense, so you know our joints have this.
Whoa, girl!
I can click a lot of things also.
Slow down.
So all joints of this meniscus, right? The disc, right? Same as the jaw.
Yeah.
So it clicks. Once in a while, it clicks. It's fine.
Yes.
But when you have this muscle ache, what happens? The muscles that's attached to this disc, it tense. It pulls forward. So when you open your jaw, the disc is forward, so you can't open wide. Then you help to manipulate, right? That's when you help. You help to click it back. Suddenly they feel relief because why? It's not stuck.
Yeah, it's in the socket again.
Yeah, it's back into the right position. That's when the patient can open and glide again. So it's like this, but imagine something is blocking you and you can't move.
Yes.
And of course you feel sore because now you're constantly trying to open, it's stuck. You can't move, it's aching, it's all together. So that's when, clicking it back into it.
Temporarily helps because there's a big connection between like what you say, pain around this area with psychology and stress and daily life. And as much as maybe they know they are stressed, but maybe there's really not much that they can do in the moment. For example, financial stress. No money means no money. Like I can work very hard, but the money's not going to be in my pocket tomorrow, right? So if there are things that we can do just temporarily to help, I would. But at the same time, reminding them that remember the root cause, it's still life stress.
Yeah.
And don't ignore it.
Correct.
Try your best to address it. I can help you for the time being to keep you going, but
it is. So I think when it comes to mental health, that's why friends, family, your support system is very important.
So true.
Right? For you as a chiropractor, clinician yourself, you talking to the patient actually is a support system.
Yes.
Your staff in the entrance, welcoming them, it's just a support system, right? Everything around them, that little positivity actually would help.
Yes.
So by you reminding them why it's there, helps them to keep their feet on the ground. You helping them feel better, helps them cope much better. So they will then get better faster.
Absolutely, because it can get quite lonely, especially things like tinnitus. Outside people cannot hear. They don't know how much it's bothering you.
Yeah.
They don't know that you have been so tired whole day when you try to sleep and it rings and you cannot sleep, that type of frustration. So the minute somebody just kind of tells you that it's not in your head, there's a reason why these things are happening.
Exactly.
Let's try to work around it, try to work to fix it. I think that can be very reassuring. So it does sound like you work very closely with mental health as well.
Yes, I mean, I myself, remember I was in Singapore, I was going through a lot, was very depressive actually, and I was diagnosed with ADHD, but the good ADHD, the hyperactive,
the smart ADHD.
Yeah, so I was telling the professor, hey, can I have the maths? Because exam was coming, so I thought the maths can help me score to be the top student. Then the prof was like, no, I'm not giving you anything. You are
ADHD maths?
Yeah, ADHD maths. Because I was hyper functioning.
So you wanted maths to lower you down?
No, I wanted maths to help me concentrate because I am hyper functioning that sometimes my brain will just go it's like that.
Yep.
So I cannot stay focused. So I wanted the maths to help me stay focused so that everything goes in.
Right.
so that I can score well for the exam.
Yep.
Then the prof said, no, you don't need it because you are functioning so well. You can study to be a specialist. You don't need it. I was like so depressed after that.
What a flex!
Yeah, I know. No, I'm just kidding. Oh, that's when, I'm gonna talk about it. But anyways, so, and then time was COVID. And I was in Singapore alone. I had no family members. My boyfriend was not around. So I was really alone. And in my cohort, there was no Malaysians. I was the only Malaysian amongst the Singaporeans.
Scholarship, by the way.
No.
Right? No?
Oh, father-mother scholarship.
Oh.
Yes, scholarship.
Scholarship, father.
Farmer.
Amazing.
Yeah, that's why I told my dad, I say sorry, ROI very hard. Yeah.
But yeah, so how did you get through that period?
So I'm very grateful for my friends. Of course, through the phone with my boyfriend, we chat a little bit. So he also got a bit battered because my psychological stress would then be thrown to him because it's just too much on me. I had to offload it. But nobody could really understand what I was going through.
Correct.
So then that's why I said, lucky I had my colleagues, my classmates, my seniors, my juniors. We went out, even though it was COVID, we make the best out of it. Then I got through it. I was like, oh, thank God, done.
And having the experience actually help you understand people who might be going through similar situations.
Correct, because I myself have TMD. I've been suffering, before I was dentist, I was suffering for almost 8 years. I couldn't really open my jaw wide. I was having this pain. I kept quiet. I didn't tell my parents, by the way, because I didn't want my parents to think I was psychotic. Because I had this weird pain, I couldn't chew. So I actually have a habit of just swallowing my food. Because chewing food became a chore. Because every time I chew, I was so fatigued, it was so tiring. So I love rice and soup.
Oh.
Just swallow. I hate burgers, by the way. Because I can't open my jaw wide. So until today, I don't eat burgers. It's just like a trauma that's ingrained that, when I open wide, it just gets very painful.
Wow.
So I don't take burgers.
So it shaped the way that you look at food as well?
Yeah. It shapes the way you eat, and then it just molds you as you go. So it was undiagnosed for many years. And then finally, like I said, I was a specialist. I was studying this prosthodontics, and then it was my specialty, and I finally understood. So I understood myself. That's how I could help as much as I can, right? The patients who are suffering this. I say you're really not alone, really not alone.
Yes, I think the empathy that you have towards your patients is so valuable. And it's something that no amount of studying and no amount of money and experience can get you. If it's either you have it or you don't.
Yeah, and then it comes with also acknowledging it. Because if you don't acknowledge the issues, you don't acknowledge the problem, then it's very hard to treat also.
True.
Right? So it all starts with understanding, acknowledging, then everything can become better.
Yes.
So do I still get it until today? Yes. Just last week, I had really bad aches on the left, on the right. I had pain on the back of the head. Every day was like headache because I was in a little bit of stress because I was preparing for lecture slides or whatever.
Yes.
So it was just a bit stressful. Yes. But then it's stress, but I'm not tipping off because I know how to manage. I know how to cope. So I spend money, retail therapy within means. I go wash my hair. I go do nails.
It's the small things. It's the small things.
So learn to love yourself. That's what my prof always tell patients who are suffering this. Learn to pamper yourself.
Yeah.
Learn to love yourself. Right? Start with yourself. Then you feel better.
When we're at this age where we've worked a couple of years, but we're not so close to retirement yet. So if we keep non-stop going through a cycle of like chong, burnout, chong, and
yes, a lot.
It's like wearing us out already.
Correct. But I'm just curious from your perspective as a chiro, how do you treat? Do you see them often? How is your treatment philosophy?
Yes. So we people see us as spine specialists. So the most common thing that people come in with is still lower back pain. Not even neck pain or headache that much, especially this year. I think that's like a trend, I don't know. Lower back pain is number one. So oftentimes TMJ is something that like, oh, by the way, I also have this thing. I wonder if you can treat. I read somewhere that chiro might be able to help. Or maybe we also have a few dentist client that is my client. And they would refer their patient over because they have like some jaw issues, neck related issues. So it's kind of like a accidental, like, oh, you can help? Okay, cool. Let's give it a go. So my approach is always to look at the spine first, because with chiropractic, we always look at spine as the origin to everything. We ask questions, similar question to what you would ask yours, like just kind of assess their situation in life, stress levels, and have you noticed if you grind your teeth when you sleep, or grind your teeth anytime? Is there a specific food that always triggers it? Or ringing in the ear vertigo and all these questions. So that part is so similar. And if it's something that I feel like I'm confident enough to treat, then I'll go ahead, hands-on. The most common thing that releases the pain or clickiness quick is a lateral pterygoid release from internal.
Yes.
And if it works, and I've done it enough time for the patient to know, I tell them to do that themselves at home as well. As long as they understand what goes on. It's basically when you wear a glove, you go in and you release the muscles from inside. They clench, they release, do some PNF to release the muscle. It's safe enough for them to do at home. But of course, I will guide them the first couple of times. So that I would say is the most common thing. But I don't really leave them there. I usually do the neck and everything and the well-being.
The well-being is,
Absolutely. You cannot just let them go without like addressing that. Like admit it, you're stressed, right? Admit it, you're not sleeping well, right? Like don't try to be like, you know.
Yeah. So this, if everyone notice and listen to what she says, it all boils down to muscles. Releasing the muscles, relaxing the muscles.
I wish we could put like a photo of the jaw here and just see how many muscles, what exactly is happening, crisscrossing all over.
Yeah, it is.
There's so many. So I think maybe for people who have suffered jaw-related issues for a while, it's good to start from there. Just understand your anatomy first, and you can kind of imagine what goes on. And determine what might be the right treatment for you. So that's what we do. And also, when it comes to jaw, a lot of the times it causes a neck tilt as well. Yeah. So that's also something we assess.
Okay, neck tilt is very interesting. So a lot of people say, because your muscles, I mean, we are humans, we are never born symmetrical.
Yes.
Right? Ears may be higher one side. So this perception of this asymmetry is a way of, when we smile, it's just a way of us compensating. That's the word compensatory.
Yeah.
Right? So for instance, shoulder. So if you always carry your handbag on one side, you tend to do this. Because why? Your muscles are stronger. They are always in a contraction trying to lift your handbag.
Otherwise, you will look like that.
You will look like that.
Yeah.
So when you do this, so there's a tendency of you smiling like that.
Yeah. There's a classic pattern, a crisscross pattern that happens.
Same. So at the end of the day, it's a lot of muscles somehow or other. Musculoskeletal is how the way your body just balances yourself. So when some people tells me they go to chiropractor, just align to, it's just helping your muscles to relax, trying to get them all into the right alignment, like the joint space, whatever it is. So, but at the end of the day, if you have pain or anything, find out the root cause.
Exactly.
Going for all this is supplementary.
Yes.
Right? The root cause.
I feel like the essence of the treatment is actually for them to understand that it's compensatory. Like it's not like I was born with a short leg, or I was born with a shoulder lower, or I carry handbag, that's why that. But it doesn't just end there. Like there's this chain reaction happening to your whole body.
I mean, you may have also, let's say example, see my hand, one side is shorter, but that doesn't mean I have an issue with that side.
Yeah.
Right? So it doesn't mean that you are born less or asymmetric or one side shorter, it means you all have problems.
Exactly. Oftentimes we have to ask their profession, and when they tell me they're a dentist and they have a spine that's coming towards the right, like, what do you expect? You are like that, 8 hours every day, right?
Then your muscles are tensed up in such a way, your bones will remodel because it's a musculoskeletal, right?
Correct.
Everything will remodel the way we put pressure on our body.
Exactly.
That's the way I would say.
So true. But I've also noticed that, especially with scoliosis, let's just put curved spine as an example, a lot of the times there are stress component to it as well, mental stress component to the scoliosis areas. For example, right shoulder stress from work, from sleeping habits. Why do people sleep on their side? Because being in a fetal position is a coping mechanism.
Yeah, possibly.
Yeah.
It could be also sleep apnea.
Yeah.
You talk about grinding, it's just another whole ball game again. I can go on and on and on. So it's not that simple during my consults. When people say I clench, I'll ask them very specific. Are you clenching or are you grinding?
Yes.
It's two different things.
Yes.
What is clench?
What is your definition?
What is grind?
Yeah.
Grind. Grind where? Forward, backward, sideways, they're all different.
Yes. But you could tell based on how
Yes.
the teeth wear.
Clench when? During the day or night? It's two different clenching.
Yeah.
For instance, if you're grinding during the day or grinding during the day, I give you a night guard to protect your teeth. Does that work?
If you're grinding
No,
in the
what?
day, no.
Yeah, exactly. So why are you grinding during the day? So to treat the grinding in the day, find the etiology. If you're going to give a treatment for grinding during the day, it's simple. Find out why you're grinding. If I ask you to wear a day guard, not a night guard, I don't think anybody can move to live their life. Every time you speak, you
A day guard, is that like what boxers wear?
yeah. So you
look like a badass for sure.
yeah, and then you smile, and then you got the thing in your mouth, and then you talk.
What if they tell you, okay, I grind during the day and it's because of work, because of my boss?
Eliminate the sauce.
Get rid of your boss.
No, you get rid yourself.
Get rid yourself. Oh my god.
But you have the choice to decide where you want to work, right? I'm not saying that, every little single thing you stress means you quit. No. There must be a certain thing whereby, if it's already at your tipping point that you just cannot cope, then you have to consider switching. Yeah. You cannot be a little bit stressed, I quit my job. A little bit of stress, I quit. No, a bit of stress in life is very good. But you need to know yourself, right? If you say every day you go back insomnia, every day you just cannot live your life, you don't want to come out of bed, going to work, then maybe you want to, and then because your boss is giving you a lot of stress, maybe you can talk to your HR, talk to your boss. Talk it out first, right? If after talking, you can't come into the middle ground, then maybe a consideration to take a break, a holiday, to kind of think back how to manage the situation better, assuming you love your job, but the job stress is just too much. Then maybe look back, reflect, and then see how you can cope. If cannot, then you just consider quitting at the end of the day, but that's your last line, because if you quit now, you no money and you lagi stress. That's not a good thing.
Life
and then you convert kata. If you keep hopping, you will never be stable. So again, reflect. I think that's the answer.
God. But having these relatively intimate conversations with your patient, does that kind of blur the boundaries a little bit, I wonder? Do your patients kind of come to you for advice that are maybe not entirely to do with?
Yes.
And how do you handle situations like that?
I mean, boundaries is drawn, of course. Nothing hanky-panky, of course.
But being a woman in this industry, I'm sure.
Actually, my patients are very respectful. Actually, I think it's how you approach and how you set the tone, right? I mean, as professions, especially you have to deal with the body. I think yours is a little bit more trickier. Where you have the tak 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 tak. Sorry, touch here. That's a bit more awkward. For me, it's just conversation. For me, it's just here. No, I don't do this lah. I don't open durian, not musang king leh. So after I kena cut like that. But so it's just a lot of conversation, trying to probe, help, like you say, be that support system. That's how my conversation works.
Do people come in just to talk to you?
Yeah. I have patients who come to my clinic just to sit in my clinic and sleep on the couch. Because they say they feel comfortable. I say by all means, okay. If it helps you, as long as you don't disrupt the flow, whatever, I'll be okay.
How do you charge them?
No, I don't charge them. We will go in front, we chit chat also.
Oh my god, that's so nice.
I mean, but of course, if it's too much, then we will. But again, like I said, most of my patients, all my patients are very respectful. They're very nice. So, nobody does take advantage. Hey, I come and use your plug to charge every day and come and do what? This is not a cafe.
Co-working space. Co-working space.
No. No.
Is there any advice you would give to maybe some dental students that are interested in embarking this journey similar to yours?
Love what you do. If you love dentistry, then you're in the right path. If you don't love the teeth, you don't love patients, just don't do it. If you think that dentistry is going to get you rich, please quit. Because it's not. Because if you don't love it, the money won't come in also. You won't feel fulfilled. Right? This is the word, fulfilled.
Yes.
And then you must quit and do something that earns you the money and you feel fulfilled.
Yes.
That's very more meaningful.
it's very hard to work ethically if you don't feel fulfilled.
Yeah. Then you feel every day is a chore.
Yes.
Right? I have friends who studied dentistry. After they finished 5 years, they didn't even do a single dental related thing, which is fine. You're not a failure in that, you know.
They just
Because
realize
you realize it's not for them. Then they found passion in other avenue, which is great. Mental health is good for them, rather than forcing yourself into things that you hate.
Because she call it TMJ, but you call it TME.
Good thing. We all have TMJ, temporal mandibular joint. We all have the joint. The pain is the disorder. TMD. Donkey, the disorder.
D for disorder.
Yeah, we all have the joints. So if patient comes in, I have a TMJ. Yeah, you have a TMJ, but you have a TMJ problem. Yeah. So under the TMD, although the word disorder sounds very severe, right? It's hard. But it's not. It's just under this umbrella there are many. So the muscles, you have the joint. Actually, TMD is so much. There is the muscle component, there's the joint component, there's a psycho component. It's very complex. Because really, there are some patients who are really having the joint issues. So joint issues meaning to say there's really degeneration. Right? It's not the muscles already. So however you treat, it cannot one. It's the joint.
It's like arthritis in the knee.
Yes.
This one can have that kind of issue.
Yes.
Also.
Exactly.
I think sometimes people forget that there's actually a ball and socket joint in the mouth.
Correct. That's why the clicks are there. Like I said, click, click.
And depending on your lifestyle, this is actually one of the most moved joint in your body. Because when you're still, this is still moving. If you're eating, yawning,
even you're
talking.
sleeping.
Yeah, when you're sleeping. And side sleeping especially. I realized there's a correlation with that too. And one very last question. How is it like working with your husband?
Okay.
That's so interesting
because
to be in the same field as somebody you are so close with.
Yeah.
Do you guys feel like de-stressed with each other, or you guys not talk about work outside of work?
Oh, we talk a lot of work.
Really?
Because it's like no troubleshoot. For example, if I did something, alright, I say, hey, you know, how come like that? Then you give me feedback, blah blah blah. You know, but during work, we keep it very professional. Actually, most of our patients do not know we have a husband and wife also. It should be that way, right?
True.
Yeah, so it's a teamwork. Of course, we have our argument days, but you know that we take it back home. Sometimes we argue in the clinic. But that's like not in front of patients, of course.
And your other associates like eating popcorn.
No. It's not like those crazy ones. But you know, the disagreement. Of course, there has to be disagreement. That's how you grow to understand each other, ma.
True.
So it's okay actually. It's not too bad. It's nice actually because I go home, or like you know, in between when I'm shagged, I'm tired, then I'll just go there and like you know, de-stress, talk to him. Or lunch, we can go and eat. Like
That's nice. Otherwise, for you to be working 7 days, it must be so hard to stay in touch with anybody, i.e. us.
Oh yeah, I know, very hard. My friends are complaining because
Exactly, like,
hey, you got no time one.
where did she go? Where did she go?
Wait, girl, I text you on social media. At least I got hello, Peachy.
Yes, we find ways to try to connect with each other again.
Correct. Although I may not be with you physically, but I'm there with you.
From afar.
Psychologically.
From afar. Incognito.
I know what happened to you. Oh, she got married. Oh, so sweet. Oh, she's traveling. Oh, I'm not at work. But yeah, again, it's all what you want. You have to find what you want.
Very true. And it takes experiencing burnout, experiencing the highs and lows to get to somewhere. And this might change. Like you might find a routine now, and then next month you want something else.
Yeah.
You want more shopping. You want more hair washes in a month.
Yes, I wish. I need more kitchen first.
Massage.
I need more inside first.
Exactly.
No, I'm just kidding.
So that it can go out.
Yeah, they go out. I know.
What would Mr. Money think watching this? Like, did you learn anything from my channel?
Yeah, I subscribe, don't worry. I got notifications.
Okay. One last question before we say goodbye until the next time I see you again. Is there an everyday habit that you see that destroys the teeth the most? What are the common habits that all of us have? We might not think that it's so bad for us that we're doing.
Not brushing and flossing well.
Okay. So the general rule, twice a day.
Twice a day. The most important is night before you sleep. Because why? in the morning, you're sleeping, unless you're sleepwalking to eat, which is no. So the most important is definitely the night, right?
Okay.
Floss, brush and floss. I think every day, you also need to be aware of your diet, right? If you're going to abuse your teeth with hard nuts every day, chomping, working, then your teeth is going to break down faster, right? If you're going to drink orange juice or those lemon, those whatever drinks, then you're going to cause issues. So I think a lot of mindfulness about your daily intakes. I'm not saying you cannot eat, right? You can, but just be everything in moderation. Mindful, everything in moderation.
Okay.
And the third thing I think is with social media, just be careful with what you see. It's not what it is, right? Don't get engrossed, don't get thrown in. ChatGPT is a good friend, to give you an initial idea. Then after that, get a consult. Do your research. So don't get drawn into social, because we are always on our phone every day.
Yeah.
So that's an everyday thing, right? That we can impact. Because every day you scroll, say example, you search for veneers, then your algorithm will be on that veneers. Then you get very engrossed. Yeah, I think I need to do it. Yeah, I need to do it every day. So I think you need to have a mental check on whether or not that is good for your health.
Yes. Look at things outside the box. And not just be sucked into it.
Yeah.
Those are really, really good advice. I think that wraps up our episode today. Thank you so much for being
Most
here,
welcome.
taking time out of your busy schedule.
Welcome,
Really,
girl.
really appreciate it.
Welcome.
And if you enjoyed this episode, please show some love to Dr. Sonia Lee from Clarity Dental. Is that your handle as well? Clarity
Clarity
Dental.
Dental at Jayawan.
Dr. Sonia Lee is the person to go to.
If you have backaches, please find Peachy. She's good at cracking jokes.
Thank you for
Most
the promo.
welcome.
1-800 collab. All right, I'll see you guys next time. Bye.